So the first thing is I always say is Dutch is an acronym. We are not testing for Dutch heritage, which we get asked a lot, but it stands for Dried Urine Test for Comprehensive Hormones. So what it does is it takes the best of saliva testing, and it takes the best of 24-hour urine testing, where you collect in a jug for all 24 hours and then take it to the lab, and puts it together. And it's basically what you do is you pee on pieces of filter paper 4 times in the day, 5 if you happen to wake up in the middle of the night, let them all dry and mail them in. So you get all of your standard hormones: estrogen, progesterone, testosterone, DHEA, cortisol, like the things you're familiar with maybe in saliva testing or blood testing. But because it's urine, you get all the pathways. So you may have a woman that's making estrogen and it looks normal, but she's going down the wrong pathway. Maybe she's going down the pathway that causes PMS or tender breasts. Maybe she's going down the pathway that can increase her risk for cancer. Testosterone's the same way. Maybe she's making normal levels of testosterone, but she's like, I have acne and I have hair here and I don't want hair there and my hair is falling out and I'm angry all the time, or I have PCOS. I'm like, yeah, testosterone can go down this pathway. It's the more aggressive pathway, the alpha pathway. And if you know that, if you catch it on the Dutch test, there's things we can do about it. So it gives you a lot of information in just one test. So you're not having to like order a serum, order a saliva, pee in a jug for 24 hours. It's just one test.
Okay. So I recognize why the need was there, because like you were saying, the pathways, I mean, it seems like, because that's always the argument with the blood serum test, right?
Right. Yeah, that you miss cortisol on the blood serum. You can do a spot cortisol on blood serum, but unless you're willing to get your blood drawn 4 times in a day to get your your pattern, it's tough. And that was kind of why saliva came about. Saliva came about to give you that circadian rhythm pattern of cortisol, but with saliva you still miss out on the pathways. It's only in urine that you can pick up the pathways.
And isn't it with blood serum, the argument is that it cannot show what hormones are active in the tissue? Is that kind of one of the...
Yeah, it's what's in circulation. So the nice thing, like the one hormone, the one caveat to that is testosterone. Like in men, you can get a total testosterone and a free testosterone. Now the free is calculated. It's not an actual free. They calculate it based on sex hormone binding globulin and total testosterone. But yeah, the other hormones in serum are what's free and then what's bound up. Because hormones are like children, right? They can't be unattended at any time. So your body makes a hormone, puts it on a bus, the bus drives through your bloodstream, and only a very few amount of hormone can get off the bus and do the things. And so when you draw your blood, you don't know if you're getting all buses, all, hormone that have gotten off the bus. You know the ratio. It's just a combination of the two.